Captopril. Chemical formula of Captopril. Drug class of Captoprilus inhibitor. A stands for angiotensin-converting enzyme. Captopril, sold under the brand name Capoten among others. Captopril was patented in 1976 and approved for medical use in 1980. Note, it may not work as well in black people. Medical uses of Captopril. Captopril's main uses are based on its vasodilation and inhibition of some renal function activities. Number 1. Hypertension. Number 2. Cardiac conditions such as congestive heart failure and after myocardial infarction. Number 3. Use of Captopril. Preservation of kidney function in diabetic nephropathy. Heart failure HF, also known as congestive heart failure CHF and congestive cardiac failure CCF, is when the heart is unable to pump sufficiently to maintain blood flow to meet the body's needs. A myocardial infarction MI, also known as a heart attack, occurs when blood flow decreases or stops to a part of the heart, causing damage to the heart muscle. The most common symptom is chest pain or discomfort which may travel into the shoulder, arm, back, neck or jaw. Often it occurs in the center or left side of the chest and lasts for more than a few minutes. Also known as diabetic nephropathy, is the long-term decrease in kidney function due to diabetes. Early on there are generally no symptoms, while later tiredness, foamy urine, and swelling may occur. Dosage of Captopril. For high blood pressure it is generally started at 12.5 to 25 mg twice per day and may be increased up to 75 mg twice per day. For high blood pressure, the first dose is typically taken at bedtime. Side effects of Captopril. Side effects of Captopril include cough due to increase in the plasma levels of bradykinin, angioedema, agranulocytosis, proteinuria, hyperkalemia, taste alteration, teratogenicity, postural hypotension, acute renal failure, and leukopenia. Interactions. It can interact with several other medicines, but severe effects can result with aliskiren, allopurinol, azathioprine, everolimus, and lithium. Overdose of Captopril management. ACE inhibitor overdose can be treated with naloxone. Mechanism of action of Captopril. Captopril blocks the conversion of angiotensin I to angiotensin II and prevents the degradation of vasodilatory prostaglandins, thereby inhibiting vasoconstriction and promoting systemic vasodilation. Contraindications. Capoten is contraindicated in patients who are hypersensitive to this product or any other angiotensin-converting enzyme inhibitor. For example, a patient who has experienced angioedema during therapy with any other ACE inhibitor. Captopril use in pregnancy. Safe use during pregnancy is not recommended. Thanks for watching.